Hi, my name is Anil Makam. I'm an assistant professor in the Division of Hospital Medicine. I'm an affiliated faculty member of the Philip R. Lee Institute for Health Policy Studies. Right now, I'm thinking most about how people are recovering from the most serious and prolonged illness from COVID. We're living through a historical event that has changed all aspects of society, including healthcare and the practice of medicine. As a hospital medicine physician, I've cared for people hospitalized for a serious COVID illness. Like for so many other illnesses, many of my patients don't recover immediately, but need ongoing care after their hospital stay in a post-acute care facility. And for many people who've survived a serious COVID illness, especially older adults and other medically vulnerable populations, hospitalization is often just the very beginning of a long journey of recovery. As such, I'm leading a national multi-center study on COVID recovery. That's called the RAFT COVID study, which stands for Recovery After Transfer to a Long-Term Acute Care Hospital, or LTACs for short. Briefly, LTACs are one of 4 sectors of post-acute care, and they specialize in caring for people who have ongoing acute or critical care needs, often after a hospital stay, and require long-term inpatient care for weeks to sometimes months. LTACs are best known for taking care of people with prolonged respiratory failure who are weaning from mechanical ventilation, often through a tracheostomy, which is a surgically created opening at the front of the neck to access the windpipe. So because of their expertise, LTACs have been a crucial part of our health system response to the pandemic, since we've seen so many thousands of people with prolonged respiratory failure from COVID-19. The RAFT COVID study will include several thousand patients with serious and prolonged COVID who are treated in 17 LTACs across the country, and aims to characterize recovery for this population when they leave the LTAC, and for a subset of our cohort up to 1 year later. We're seeking to understand who recovers, what predicts recovery, and whether there are ongoing disparities in who recovers, as well as whether recovery from COVID is uniquely bad or similar to recovering from other serious and prolonged illnesses. The RAFT COVID study will provide insights into the recovery of people who've had or have the most serious COVID-19 illness. Even if the pandemic were to end today, there's already over 100,000 survivors, if not over 1 million survivors in the US with prolonged COVID illness, if not millions worldwide. And as we've experienced with Delta and now the Omicron variants, COVID-19 is expected to be an endemic illness that will continue to face in some shape or form moving forward. So understanding how people recover from COVID can help people better understand the recovery process and inform decision-making both at the bedside as well as at a health policy level to better match healthcare delivery services to the needs of survivors.